Hello, this is Dr. Susan Sarajari from Dominion Fertility. I wanted to just say a few things about recurrent pregnancy loss. And recurrent pregnancy loss is basically defined as 2 or 3 pregnancy losses. The majority of pregnancy losses in the first trimester are usually due to chromosomal abnormalities in the embryo. But there can be several different other causes of pregnancy losses. And I wanted to go over the testing that we normally do when somebody has recurrent pregnancy loss. First off, we evaluate the uterus. We usually do a hysterosalpingogram to take a look at the shape of the uterus, and we also do a saline sonohysterogram to make sure there is no lesions such as fibroids and polyps or septum in the uterus. In addition to that, we then take a look at the parent's chromosomes, because if there's abnormalities in the parent's chromosomes, that can potentially also have abnormalities in an embryo, which then can lead to a miscarriage. We also test certain antibodies pertaining to something called Antiphospholipid antibody syndrome. Again, this is a blood test, and we also oftentimes do a thrombophilia panel, which is blood tests for testing for certain clotting factors in patients' blood. And sometimes if patients have either the antiphospholipid antibodies or an inherited thrombophilia, then they might have to be on baby aspirin or a blood thinner or both. Other things that can contribute to recurrent pregnancy loss is also uncontrolled diabetes or thyroid disease, obesity, smoking, alcohol use, or drug use. So there's several factors that go into it, but this is basically what we look at when we do an evaluation for recurrent pregnancy loss. Thanks so much for joining me. It's Dr. Susan Sarajari from Dominion Fertility.
Dominion Fertility, making miracles happen, one family at a time.